Yeah, so concussion baseline testing is designed to get a norm on a patient so that if they're concussed, we can come back, we can test them again and compare it to the study that we did before the injury. This lets us see how severe the injury is, helps us determine some treatment parameters, and it also helps us to make good calls on return to play if that's a goal. So if this is a sports concussion and that athlete desires to go back into the game, we've got to have valid protocols to decide when they're safe to go back in. Well, baseline testing is one of the type of tests that helps us make that call. And essentially, it is a battery of tests, or should be a battery of tests, to help make that decision. One of the challenges with baseline testing as we know it is that there are some very inexpensive ways to do a portion of the baseline testing. Now, the impact test is the most common one that's used out there. The inventor, the creator of the impact test, said specifically it should not be used as a standalone tool for return to play or making these calls. Yet, many schools and organizations use it because it's a simple $25 or $20, I believe, to do the assessment on a kid. It's a piece of cake. It's done. The problem is it gives us very limited data. So in my practice, we do what we consider to be comprehensive baseline testing. Yes, we're gonna assess the cognitive pieces, the reaction times that the impact takes into place, but we're going to go through a much greater effort to get data from this athlete. We're going to take them through a screening neurologic exam, looking at brain function. We're going to take them through a post-traumatic vision screen. We're going to look at a standard concussion tool that's called the SCAT-3. They're going to be put on our computerized balance plate or posturography to assess balance and equilibrium. And we're going to get a really global idea about how their brain functions so that we have solid objective information to make return to play calls and to really make the diagnosis of concussion.